the Human Services and Aging Committee to order today for Wednesday, March 20th. Can we have a roll call, please?
Calling the roll, Ms. Conwell.
Here.
Mr. Jones.
Here.
Ms. Brown.
Here.
Mr. Miller. Here. Ms. Stevens. Ms. Stevens is absent at the moment. There's a quorum.
Thank you. Anyone signed in for public comment?
No, Madam Chair, no one is signed in.
Okay. March 6th, approval of the minutes for the March 6th meeting. Is there a first and a second?
So moved.
Moved and second. All in favor say aye. Aye. Minutes have been approved. We're going to go out of order today, and we have, which I think is very important, the modernization efforts that have been put forth for the Cuyahoga Job and Family Services. This is, it will explain in detail about the call system and how we have improved to date. So we'll have Director Gowan, please.
Thank you. I wanted to give a brief update to everyone regarding the JFS Contact Center and how things are going. So without any delay, okay. Just a brief history to everyone. We've undergone a fair amount of rapid change over the past 6 months. In January initially was when this contact center was launched. It was launched as a phone-based eligibility system. It was originally designed for Medicaid. In the summer of 2018, we added SNAP and our OWF cash eligibility, SNAP being food assistance. And call volume at that point rapidly rose from 10,000 calls monthly to 67,000 calls monthly. Also in the summer of 2018, we moved from the CRISI system, which had been in place since 1992, to OBWP for the SNAP program. And then we changed from a caseload environment where individuals were caseloaded to a case bank environment where the casework was shared across all workers. I want to reiterate, this is an eligibility center. It's not a traditional call center. It is meant to take the place of the lobby. It's a virtual lobby. It's a new service delivery model for all of us, in which, quite frankly, we're still feeling some growing pains both on the behalf of the public and ourselves. The important point being the clients do not need to leave their homes to do an interview. They can be approved for benefits via the phone. And even more importantly, first call resolution, they can call, apply for benefits, and if we have the ability to verify their income and other details, we can often approve them then and there, which is a first for us with this call center. All of this was done in terms of modernization and bringing these systems online, and especially the call center in alignment with the strategic plan. With Goal 7, we were trying to bring a robust and responsive eligibility center that supported self-sufficiency. Goal 6 of every resident on path towards upward mobility, we want to address barriers. That's what JFS is here for. We wanted to provide a superior customer experience by streamlining the eligibility center and reducing wait times and increasing the convenience for the clients and increasing real-time eligibility, that first touch resolution I just talked about, where people can get approved over the phone. And finally, we wanted to make Cuyahoga County an employer of choice. Okay? Recently, we've been empowering the centers to address their particular function, and empower the employees within the centers to address their particular functions as a team and give them a say in how those goals are met. This has not been a smooth road. It's been a bumpy road, as I think most of you know. We experienced that call volume I just referred to, almost a 7-fold increase in call volume as soon as we put on the SNAP program. We experienced long wait times, very long wait times. We had all interview calls handled by 3 centers, 3 of our neighborhood family service centers. And then we had a customer service piece of this entire eligibility center that was handled at Jane Edna Hunter, by the staff at Jane Edna Hunter. When we went with that model, which actually is represented here, there was a lack of focus. So any one of these calls, SNAP intakes, SNAP applications, Medicaid renewals, Medicaid applications, and SNAP redeterminations were all handled by those 3 centers you see here, Virgil Brown, Old Brooklyn, and Quincy Place. And then that customer service line off to the side was handled by the staff at Jane and the Hunter. So that was, did result in long wait times, and so we decided to take a more of a case-banked approach and a more systematic approach to dealing with this. And in a case-banked approach, you have an intake team bringing cases into the system. Once they're approved, the case is moved into what is traditionally known as the bank or the case bank. And then the employees are responsible for dealing with the day-to-day once that case has been approved. And their day-to-day tasks that are associated with that case bank. In this case bank environment, the team addresses those daily tasks together. That's when I talk about empowering the people to decide who does what, how do we handle the work coming in. So visually, it looks like this. We have calls coming in, people enter their zip code, and people should understand that this is a state-generated eligibility center, so 76 counties currently are taking part in this. Very few counties are not on board with this call center. But they call the one number for the state, they put in their zip code, it gets routed to us, and then they answer questions basically, are you calling to apply for SNAP? Are you calling because you have a SNAP interview today? Are you calling because you have a SNAP redetermination? Depending on that answer, they're routed to a specific center. You can see that represented here. Quincy is SNAP intake, and Old Brooklyn is redeterminations. Our Janet and Hunter or Southgate is Medicaid renewals and applications, and customer service was switched over to Virgil Brown. This provides a little more focus as to how they actually get their work done. And I'm going to move ahead. This was also effective February 25th. Okay. As part of that change, we also changed the way customer service works. Okay. Customer service, we actually experienced our worst wait times initially. And we were doing that one of the reasons, to be quite frank with everyone, is that it was option 2 on the call line. This is not something I can change. I've asked the state to change that, but when anyone calls in and option 2 is customer, I want to speak to a customer service rep, they're going to pick option 2, and that's what they were doing. The unfortunate reality is the interview lines we had much more staff assigned to because we have an obligation to cover those interview lines because we have told those people to call in today to do their SNAP interview, to do their Medicaid interview. So the customer service had less resources attached to it. What we did was we added 2 tiers of customer service. We had clerical staff on the front end, triaging the call, because a majority of those calls actually should have been routed to one of the other interview queues, and that's what we're having them do. Okay, you actually have a SNAP interview today, I'm gonna get you to that interview queue. And they can answer some quick customer service calls. What are our hours? Where should I go? Where's the closest center? Did you receive my documents? Some simple stuff. If they actually have a call that can't be handled by a clerical specialist, it's forwarded to a tier 2 customer service specialist, which is really an eligibility worker at that point. It worked so far anyway. So you can see right here, wait times. And I really just have 2 months of data represented at this point. But I wanted to show everybody wait times dropped from an average of roughly 33 minutes a day, and on average, down to what you see here. We're averaging around 15 minutes right now. Our best day was actually last Friday where we're under 12 minutes. I want to point out these are averages. We do still have long wait times in lunchtime, and we're fully aware that that's an issue and that we're not there. We have some place to go. We have some improvements still to make. But the improvement that was made as a result of the restructuring of the center has had an impact. So we've cut wait times in half, and you actually can see, I'm not sure if it's in this one. Yeah, it's not going to be that. We're answering more calls. Previously, we were answering roughly 41% of the calls, which is an absolutely unacceptable level. And after the change, we're answering roughly 70% of the calls. There are days where we answered 75%. I think the 28th was actually the first day where we answered 75% of the calls. And it's not just that we're answering a higher percentage, we're actually answering a lot more calls. So if you look at this graph, you can see that obviously highlighted in red is the first day that we did this. We answered more calls than ever before. We answered over 2,500 calls compared to our best calls our best days were around 1,500 calls prior to that. And that trend has held. We've never answered less than 1,900 calls since we moved to this model. So in the first half of the month, in terms of service delivery, We normally experience heavier volume. We have redeterminations are always during the first half of the month, and people tend to contact us at the first of the month to apply for services. So just looking at the first 2 weeks of February versus the first 2 weeks of March, we were able to conduct 1,200 more SNAP interviews in March than in February. We were able to conduct 923 more SNAP renewal interviews in in March compared to February, and 347 more Medicaid interviews in that same time period. And we've had roughly a 20% reduction in lobby traffic as well. I just got some recent numbers from Virgil Brown. I actually spoke with security at Virgil Brown, and they noticed a drastic result. And they're kind of like, I'm not sure when it was, and I just said February 25th. It's got to be when it is. But they noticed. I talked to the sergeant over there. So we have seen a decrease in lobby traffic, which is one of the goals, is to make it so that people don't have to come and visit us. They can do this over the phone. Okay. This has also had an impact on the management team and the management of the organization altogether. We're able to more clearly see what's going on, who's not being serviced, and we're able to deploy resources better and just do better planning. We've been able to address workloads, or backlogs during this time period, or actually started that in January, and drive backlogs down. And much of this is a result of the reorganization, as well as some other actually help that we got from IT and tracking backlogs. So that's where we're at today. Does anybody have any questions?
Councilman Jones.
Yes, back on the impact calls answered. Help me to understand what I'm saying. It says, the second page, it says over 2,500 calls were answered on February 25th.
Yes.
Right. But
Yes.
the page before says 50% of the calls answered. Does that mean there were 5,000 calls and you answered 2,500 of them? Or?
So in this case, so if you look at February 25th, it was 2,500 calls were answered. Then the next page, the page prior to that, yes, that means that on that day that there were some 2,400 calls. It's less than 2,500 that were not answered. Yes, that was happening. That rapidly improved once things started to take shape. But that first day, that's what happened, which was unfortunately still better than our average prior to that.
So that means you still get roughly 4,000 calls at least a day?
It's averaging around 3,600. It's anywhere from 3,000 to 3,600. Mondays are the heaviest.
So then that means you get back to them the next day maybe? Or when do you get to the
So-
other half?
Yeah, so traditionally with people in the call center, you can never hit 100% simply because it's rare that you hit 100%. 95% is really good, because those 5% are people that they just give up right away. They hang up and they don't want to wait around for you. 75% is obviously much better, but it's not where we want to be. We want to get to those 90% range. But the expectation is, as we start to answer more calls and increase that percentage, the volume of calls will go down. Even the calls offered. I'm hoping that it goes down to less than 3,000 on a daily basis.
Okay. Can you speak to Maple Heights, how things are going on there? I know a few years ago we had to make some changes and close a facility, and now you put a pilot out there, and how is that going, and how does that tie into what we're doing here?
In terms of, I'm not sure I followed you there, and I apologize.
Okay.
I took over in October, so
Gotcha. I'm not asking
some of the
the
history I
question.
might not have.
Okay, I'm not asking the question the best way, but we had a facility in Maple Heights that was closed.
Yes.
And the executive and working with the mayor came up with a pilot of how they could start to provide the cash benefits to the residents of Maple Heights and the surrounding cities through the senior center that they have there. There was a navigator placed on location, and I have not been in the building to see to lay my eyes on it, but it was a pilot. And I don't know if you're not familiar with it.
Yeah, I would have to. I can get back to you, but yeah.
Okay, we can talk later about it.
Okay.
Okay, thank you.
Councilwoman.
Thank you. I have quite a few questions. You talked about the case-banked approach and the intake process. You mentioned a team. How many individuals consist of that team that handles the intake?
The SNAP intake is at this point 60. You forgive me if I'm not dead on, but it's either 60 or 61.
60 or 61. And how many are associated with the ongoing caseload?
So with the ongoing caseload is the rest of the team. So if I add it up, there are roughly, it's roughly 260, 270 people. It's including the customer service team.
Okay. Are there still benefits analysts in place?
There's still benefits. I'm not sure I
I
follow the
think there's
question.
eligibility.
Oh, are
They're
they?
called eligibility specialists is what I think.
So yeah, it's eligibility. They are still eligibility specialists who are manning these phones and conducting these interviews. If that's what you're asking me, yes.
Okay. You talked about the interview process. So the interviewers, are those the same as the ongoing or the intake individuals?
So, and I'll kind of stick with SNAP for the moment, but for SNAP intake, they have an interview, and then for SNAP redetermination, they have an interview. They're similar. Redetermination tends to be shorter simply because we already have the case. We're seeing if there's any updates to their current situation. So, but the interviews are very similar.
Okay. And can you define answer? Is that just a hello when we talk about the answer numbers that my colleague Councilman Jones touched on, or is that a successful call that the client who reached out to us has been satisfied with the reason that they called?
How long it takes us to complete the call, essentially?
No, answer. This answer just, we got a chance to say hello. Is that?
I get you. Okay. So the when we say answer the call, we have, yes, resolved the call at whatever level we can. We may not be able to approve them for benefits because oftentimes they have to provide documentation. If we can, what we call ping the hub and verify electronically the income information they're giving us, we can potentially approve them there. Oftentimes we have to ask them to provide pay stubs, documentation of their income and their expenses.
Okay, so are we tracking that information as well? Are we tracking our resolution rate, if you will?
So what we do track is, and this is coming through the state, it's all their technology.
Mm-hmm.
So when we say answered and resolved, we address the client, we didn't just say hello, we answer their questions. We, in the case of the 3 lines, we conducted an interview for the most part. If we're able to approve them for benefits, that is tracked. It it lags behind. So like, I couldn't tell you how we did last week, but I can tell you that roughly over the past, we lead the state, or at least we were well above the state average, with about 76% of our Medicaid calls have a first touch resolution where we're actually able to approve for benefits, and roughly 65% of our SNAP cases, that's true. So we're above the state. The state average. State tends to lag 10 to 11% behind us in those numbers.
Okay, keep up the good work. And I guess my last question. I'm sorry. Oh, with the wait time. Congratulations on the significant reduction in that wait time. Do we allow or announce to the caller that your wait time may be, I've heard that on some systems, and to kind of give them a prepared?
We do not.
No.
So we do not. It's again a state call center, and I've recently established a relationship with the people it's a vendor who's in charge of this. It's one of our questions to them. It's a debate across the state whether you want to do it. There's different kind of philosophies.
Okay.
Sometimes it makes people hang up quicker. Some people. There's a debate out there. I'm in favor of it because I think our clients should know, and they can call at 11 o'clock. There's a 55-minute wait time, then hang up and call later in the day.
Okay.
But yeah, it's not currently
So that's
available.
more of a state issue, and
It's a state decision. I wouldn't even call it it's a state decision, and we would lobby for that.
Okay.
We haven't lobbied heavily for it at this point, but it is a state decision.
Okay.
Yeah.
Thank you, Madam Chair.
Councilman Miller.
Madam Chair, Director, when I met with the food bank a couple months ago, they said that regarding the SNAP application process, that all or almost all of the applicants they could not be processed on the spot, and they had to be sent a letter which directed them to call and set up an appointment to verify their eligibility, their income, and other such things. And my question is whether that's still the process or whether an improved process has been developed.
So I will speak to what I believe is what they're referring to. When you apply for Medicaid, just by comparison, you can actually be approved for Medicaid without an interview. Currently, the federal regs do not allow us to approve a food stamp recipient, a SNAP recipient, without an interview. So that's a federal requirement, and the state's not going to make that change. So if you apply online, which is the preference for us, it's easier for planning. It's fairly easy for someone to apply online. They will be scheduled for an interview, and they will have to call into the center, yes. So I do not see that process changing. That's actually a state decision as opposed to a county decision.
So are we still doing the process where if they apply over the phone, they then have to be sent a letter telling them to set up an interview?
No, if they apply over the phone through this call center, we can take an application over the phone. It's roughly 20%. I'm going off of memory, but it's roughly 20% of the SNAP intakes that we do are a cold application over the phone. Whether they get approved or not, it may be the issue they're referring to. They can't be approved if we cannot verify their income and their expenses and over the web, through the databases that we have access to. And so oftentimes they'll be told they have to send in documentation, but they shouldn't have to do a second interview after that. The initial application. Now, if they come in, apply in person, if the lobbies were swamped, they may have been given an interview date for later. But when they call over the phone, they can actually apply over the phone. I can't guarantee, and I think first touch resolution on a phone application is probably lower because it is a cold call, but they can apply over the phone and conduct the interview at that point.
So what the food bank was saying is that the applicants had to be sent a letter telling them to call in and set up an interview, and that in a significant percentage of cases, these letters were being sent to the wrong address, and the applicants never received them. So my question is, when is it that people have to be sent a letter asking them to set up an interview? Why can't they just, if it can't be resolved immediately, why can't they just set up their interview time either when they call on the phone or when they apply online?
So when they apply online, they're calling. When they apply online, we get a set of interviews to schedule, and that's largely due to staffing. So we get roughly 7,000 applications a month, and we schedule 300 to 350 of those to be SNAP interviews to be handled daily. And in order to have the staff there to handle those interviews, we schedule them out as such. The address issue that they were referring to is they brought that to our attention in November, December. We were able to share some information with us so that in January we were able to pinpoint a problem with data entry, and we're able to fix that problem. And we meet with them regularly to see if any other similar issues come up. So I believe that the address issue's been corrected. But they can, to go back to your original point, they can apply over the phone, and we will do the interview over the phone. It's easier for scheduling purposes and for staffing purposes to make sure that we have the people available to conduct the interviews, that they apply online or through paper. and we schedule their interview for a later date.
So, let's take each of the two cases. First, let's take the case where they apply online. When they apply online, then how does their interview get scheduled?
It goes to our clerical team who puts them into a calendar with essentially a cap of 300. If we get an excess number of applications, we may increase that cap to 350 per day. We have to get those scheduled out at a maximum 2 weeks ahead, away from the initial application. So we make sure it gets scheduled within 14 days.
So they apply online, you receive their online application.
Correct.
You schedule them for an interview time.
Yes.
And how do they get notified of when their interview time is?
They are sent a letter, yes. And they could also log back into the system later on to see it.
So they're sent a letter saying that your interview time is such and such.
Yes,
And so then they have to call in and
correct. Correct.
And if they call in over the phone, can their interview time be set up over the phone, or does it have to be done later?
You mean if they apply over the phone?
If they apply over the phone,
If they call in with a cold application, we will conduct the interview then. Yes, yes.
what happens if you do the interview over the phone, but the financial data cannot be verified, which I presume is going to be most of the time?
Much of the time, it's not necessarily most of the time, but if we can't verify their current income and expense data, then they're told they need to mail it in or fax it in. They can also walk it in, and then once we receive that documentation, we process the case. They will receive a letter telling them that as well, but they're told over the phone they need to submit their documentation.
And after they submit their documentation, they don't have to do a second interview, is that correct?
Correct, correct. They may be contacted because something's not clear, but it wouldn't be an interview.
And what percentage apply online and what percentage apply over the phone?
I can't tell you, unfortunately, we haven't got great numbers around how many are applying online. I can tell you that, as I said earlier, it's roughly, I prefer to get back to you on it, but it is roughly 20% of our applications are over the phone. And the rest of the applications are a combination of paper, online, and some in walk-in applications.
And getting back to the case bank system, that means that individual workers don't have an identified caseload. Everybody works on everybody. Is that correct?
Yes, in that not everything. They mentioned Quincy Place is our intake center for SNAP. So Quincy Place works on intake functions. They get that case, they bring it in, they do the interview, and then when the documentation comes in, they approve it. So redeterminations are handled by the Old Brooklyn Center. When they do the redetermination interview, there's follow-up documentation often around that. They'll take that and they'll complete the case. And so it's functionalized so that not everybody's doing everything. We try to functionalize it by what needs to be done, the major tasks involved for JFS. But the team as a whole is responsible for the case, correct?
Is this creating a problem when some kind of glitch develops and I want to call somebody and get it resolved, and I don't have an individual caseworker, and you know, it sounds like you no longer have a particular individual who's familiar with your case.
So I would say that we're one of the last counties to go to case banking. The majority of counties have gone to case banking, and I've actually been through case banking in other counties. And what you actually see happening is you get more transparency as to what's going on. Caseloads depending on whether the worker's very good, whether the worker's there on a regular basis, and case banking, when you call, your case is addressed. So the customer service line is really set up to deal with calls that are above and beyond the interviews, and that's how that would address issues. That's how we address issues through there. And when issues get escalated, they get escalated to my office, and we respond as rapidly as possible.
Is the case banking system being used just for the intake process, or is it being used for ongoing service as well?
So it is used for SNAP, Medicaid, and TANF cash. The SMBC, or the long-term care program, is completely separate, but they have essentially a case bank approach. But that's a very specific piece of Medicaid. But essentially all of JFS is taking part in some way, shape, or form in case banking.
Okay, fine.
All right, just wanted to follow up on Councilman Miller. He was talking about SNAP. So is it the same? It's the same process for Medicaid renewal. Who is the company that we contract with that actually verifies the credit history?
So in terms of income verification that's handled through the state and federal databases. So we have access to W-4 filings, quarterly wage information. But we're obviously dealing with people who are facing poverty, so they don't always have information in those databases.
And so, because I called in for a customer to do the Medicaid renewal online, to help them and assist them, because it's much easier than having to go to the mailbox and all that. And so did it after hours, and I guess it was this company that someone contracted with and they needed to verify the credit history of that person. And they said they were unable to, I don't think it was due to the time, but just unable to verify the credit history for that person. So at that point, the online application couldn't be completed, and they referred.
For JFS?
Right. I just called the 1-800 number.
I would ask that you refer that to my office, because I'm curious as to why they would say that. That doesn't make sense to me, but I may be missing a piece of the information.
I try to walk through these systems sometime to see how they actually work. How is the work triaged to the team? So back on, I think on case banking page, you stated that various teams come together. How is the work triaged to each of the teams, since there's no longer caseworkers assigned to each
So when I referenced triage back in the customer service slide,
case bank approach?
what I was referring to is that when we initially put up the call center, we had people pressing customer service who weren't supposed to be calling customer service. The customer service was the ludicrously long wait times. So when I say triage, I mean they take the case. What does it really need to go to? And they say, well, actually, you have a SNAP intake interview scheduled today. We're going to send you to that queue.
No, I don't mean the phone call. I understand the phone call process. I mean in terms of the actual workers. So how is it triaged? Because our minds have to get away from the individual caseworker working on this. So once that call comes in, how is that work triaged to which worker is going to take it? Is it the one that?
Understand that.
Okay,
Thank you.
sorry.
So obviously the 50 to 75% of our staff are on the call center. That's kind of our first priority. And the rest of the staff are on paperwork, is what I usually refer to it as. We've actually, the Department of Information Technology helped us design a tracking system that loads the work daily. And then they track when they've done. So if there's a case that's pending application, and we normally have over 4,000 SNAP applications pending, but that's because we get 7,000 a month. And those pending applications are waiting to be worked. We're working to actually improve that system so that when documentation comes in, it flags the case, the documents are in, moves it up the priority list for working. But yeah, we have a system that tracks all the cases. And essentially by work, here's the pending application, here's the interim reports, the different work that needs to be done.
And internally, the 50 to 75% on calls, and then the 25% that are up doing paperwork, that switches around so no one gets bogged in with just calls or. Does that rotate a little bit, or is it?
Yeah, people rotate with their responsibility. Then not everybody spends every day of the week on the phone.
Okay, and I just want to be clear on, has the state fixed the option 2 feature?
Which feature, I'm sorry?
The option 2, I think that was the,
No, they have not.
Okay.
No. They said they were going to, and then they said, oh, we can't do that this time around.
Okay.
When they gave us the tier 2, the 2-tier customer service, they said they were going
so
to do.
that was their,
That was the fix that they helped us with, and then they loved the idea of moving it to the end of the queue. I don't know, I didn't get a good reason why they didn't do it, but it's still option 2.
will they come back to that?
I'm going to come back to it.
Okay.
I'm definitely going to come back
Because
to it.
I know there's new budget cycle coming around, so I was just wondering if they gave you like a definite that they were going to fix that, even though we have a temporary fix.
Yeah, and they have, and the state, because they answer to 76 other counties or 75 other counties with regards to this initiative, has to prioritize everything they do. They actually rolling out next week some more enhancements to the call center. Unfortunately, the moving customer service to the end isn't one of them, but
Okay.
that is on their list now. Yes.
And I guess my last question, what do you see is the need going forward? What are your needs left on this call bank system?
So, like I had mentioned, while this is a fairly dramatic improvement, we're not where we need to be. I'm going to see the long wait times go away. We do currently have 40 vacancies. We have 40 vacancies, 12 people in training, which means really I have 52 positions that aren't working on the floor right now. Those need to be filled as quickly as possible. And I think when we get those positions in, we're going to be able to drive the numbers down in terms of wait times and drive the numbers up in terms of clients served.
10 are hired now?
I'm sorry.
10 new hires?
12 are 12.
12 are
12 recently
training
were
right
hired
now?
March 4th. Yes.
And they're training.
And they're in training. It's a 2-month process.
Because I know one of our contracts that were coming up today has some of our eligibility specialists. And so I wanted to see if that's impacting for Board of Developmental Disabilities. That's impacting you as well, correct?
And they'll be, and Christie's here to talk about that. But those people aren't part of the call center. That's within our specialized Medicaid area.
Okay, thank you. Any other questions? Councilwoman Brown.
Thank you. I think last week the state approved some funds towards, it might have been Jobs and Family Services, but I'm not sure. Are you familiar with that? And I think it may have been the State Department of Job and Family Services. And just wondering if that's going to have an impact, or if you're aware of it at all.
I'm not aware of it at this point.
Okay,
No.
thank you.
Any other? All right, well, thank you,
Thank
Director,
you.
for coming in. We needed that update. All right, Madam Chair, if you could read the first.
I should explain. I have tinnitus, so sometimes I continue to it. What was your question? I apologize.
Oh, no, I said thank you.
thank you.
I was just going to, we were moving on as you
I
were
was moving
walking
on.
away.
I apologize.
You're good.
So thank you very much, though. I appreciate it. Okay, thank you.
Madam Chair, if you could please read the next item into the record.
Resolution number 2019-0073, authorizing Title 4D cooperative agreements with various providers in the total amount not to exceed $107,270.84 for child support services for the period 1/1/2019 to 12/31/2019.
All right. Welcome.
Thank you. Good afternoon. I am Tiffany Dobbins-Brazelton, Director of the Office of Child Support Services.
And I'm Richard Weiler, Financial. The two contracts in this resolution are contracts where they collect child support cash payments on our behalf. The Treasurer's Office last year collected $2.1 million for us. They collected 10,250 payments. The Juvenile Court cashiers collected $500,000 in cash for us, and they did 3,100. Took in 3,100 payments.
Okay. Any questions in regards to that? Is that where the number should be? Around, I guess in terms of who's mandated to pay child support, is the numbers?
Well, these Again, these are just cash payments, so, I mean, this is a small percentage of the
What you really
240 million
fund.
that we collect.
Okay.
But some people just want to pay cash.
And we're fully reimbursed, correct, for our operating costs, aren't we?
We're not fully, we get reimbursement from the federal government and from the state, but there is local dollars here also.
Okay, and some health and human services funds
Levy.
go into that too.
Yes.
Okay. Any other questions? Councilman Jones?
To your question, is that percentage, is that 66%, 2/3, or what, of the federal reimbursement for us?
Okay. It's kind of diluted in that typically the federal government reimburses child support 66%, but that's after program income is deducted from those expenditures, okay? We have two sources of program income. We have the fee, 2% fee that we collect, which was $4.5 million. And then we have federal incentives that are considered program income, and that was about $3.5 million last year.
The actual legislation says federal funds 58.5,
That's because after you
take off.
take that program income, it comes down to that amount.
Yeah.
Thank you.
All right. Anything else you'd like to share in terms of that contract?
No, Rick already pointed out, so we just try to give everyone the opportunity, as many opportunities as you can to pay child support. Most of our funds are collected through income withholdings, which is the preferred way and the easy way when a person is employed to automatically attach their wages and have that come in, and that goes directly into the state. But we try to offer as many opportunities as we can within the county to get other sources of payments collected.
Okay. And I guess the garnishment, is there a lot of garnishments and things like that?
Yes, yes, that's the primary option that we take. So it's required if we have an attachable income source. If you have a bank account and it supplies with that information, we also attach bank accounts. But if you have an employer, we expect you to give us that information, but if you don't, we seek it out and we automatically attach income.
Okay. Is that still a stigma? I know at one time, speaking with the previous director, there was some kind of movement in terms of working with employers because it was set up like it had to be a garnishment anyway, and some people frown against garnishments. And I know she had talked about there was some work being done with various employers around the county to kind of not in the workplace look at the person as, you know, in a certain kind of light, because it is something that we have to do. We have to garnish. It doesn't mean that they don't want to pay their.
Right, so I'll speak specifically to Cuyahoga. We do try to work with our employers, the employer community. We are, I think this is our 5th year, having an engagement with employers that we'll have around, I think it's September this year, that we bring employers into the room to explain different nuances of child support, what it means, take their questions, get that information out so that we can try to form a relationship with employers as well as to give them an understanding of what the concept of child support really means, because there are a lot of misconceptions that we have found since we have started putting on this employer engagement. So we actually lead. The state looks to us in terms of what we do to engage with the employers. And so we hope to grow that venue, and we'll let you know about it, but we hope to grow that this year and expand the number of employers that come in to hear that information, as well as other avenues to connect besides directly having them come in and have to sit down. So we're looking at a variety of things to do with that.
Is that a lot of paperwork for the employer?
No, we issue the paperwork. So sometimes employers aren't clear on how to get that onto their payroll, or we want to make sure that you understand the law in terms of requirements into how frequently you need to issue it after you the payments are deducted, how soon you need to get that out, so that we can have consistent payments and have the frequency correct coming in through our office.
So we actually work with many HR departments.
Yes, correct.
Okay.
and we definitely try to hit those big employers. We identify those employers. We send invitations out as well so we can connect with these folks.
Yes.
Councilwoman Brown.
Thank you, Madam Chair. So are these contracts for administrative costs primarily? Is that what we're looking at here?
Yes, it's just a way that the county can get federal dollars back, basically, from, to help defer the cost.
Okay, and then in that case, is this figure determined by the percentage of outstanding funds, or how do we come to this number how do we come to this number?
Okay. What we do with the treasurer's office is they devote one full-time person. They got one window, and we pay the full salary of that person.
Okay.
They have like 6 windows, so they devote one person to take the child support collections because of the volume. And then we pay like 15% of the supervisor's salary. At juvenile court, it's a little bit different. Everybody in that area in the cashier's department, we take all their cost, and they take in a lot more than child support payments. They may take in, any type of fines for juveniles. And so what happens is we come out with an average cost per transaction, and then however many transactions they take, we pay the percentage of child support. So if they take in 1,000 payments in July, and 300 of those are child support, then we would pay 30% of all their costs for those 3 staff.
Okay, that's helpful. Thank you. Thank you very much.
All right. Deadline on this, it's kind of behind, so I agree that I think you want second reading suspension, am I correct?
That is correct.
All right, so
I apologize. I got it in even earlier this year, and I thought I'd get 3 readings, but I had everything in by February 8th, but it took like almost 4.5 weeks to get on your agenda.
and what's your name again, sir?
Richard Weiler.
Those things happen, I'm learning. So I'd like to move R2019-0073, make a motion to move that second reading suspension. Is there a second? Second. It's moved and seconded. All in favor say aye. Aye. All right. And Madam Clerk, if you could read the next item into the record.
Resolution number 2019-0074, authorizing Title 4D cooperative agreements with various providers in the total amount not to exceed $11,337,752.39 for child support services for the period 1/1/2019 to 12/31/2019.
Again, these are agreements with domestic relations court, juvenile court, and the prosecutor's office. The prosecutor's office is the legal representative for child support in both domestic and juvenile court. Last year, they logged in 39,000 hours of time, and it would at an average cost of $93 an hour. The juvenile court and domestic court, we pay each one of those by journal entries. So it's not until they actually produce some type of journal entry do we count that as work. Domestic relations court did 8,400 journal entries last year at an average cost of $386. Juvenile court did 9,200 journal entries at an average cost of $325.
Okay, I apologize. So juvenile court was 9,200. How many were the prosecuting attorney?
The prosecuting attorneys, we pay them by the hour. They did about 39,000 hours.
So the other domestic relations was 8,400 then.
Correct.
Go ahead. I'm sorry. I apologize.
That's okay. I went kind of fast.
Is there anything else you'd like to share?
Well, I believe their services, we have quarterly meetings with them, and I believe we are getting along with them better than ever as far as any type of issues that we may have. Do you want to add something?
We're working to collaborate with both courts as well as the prosecutor's office to have better customer service delivery. So we are also moving to tackle a lot of different changes that are coming legislatively that are actually newly introduced even within the last week. So there's a lot of collaboration going on that I think Rick is right. We're working with everyone better than ever. So it's been progressive.
And so all of this probably goes to why these two contracts, although they're similar, they're kept separate, correct? The one we just passed.
Well, for reimbursement purposes, we have to keep them separate.
I knew that was explained before, but I couldn't remember. Okay. And you'll probably get asked it again. All right. I'd like to make a motion to move. Okay, Councilman Miller, yes.
My question is whether the total amount of child support payments over the last year is going up or down.
Are you speaking to our collections?
Yes, total collections.
We've actually increased our collections over the past couple years. I'm sorry, I don't have the numbers with me exactly to give you the comparison, but yes, we've had some increase as far as our actual collections.
And how are you doing on the collection percentage? The last I heard, it's somewhere around 60% of all that's owed is collected.
We're somewhere in the middle as far as our federal performance incentive numbers. Our dollars obviously have a great impact to the state, and that's where we excel as far as our dollars. Currently, the federal performance incentive formula and everything is being looked at and reviewed and changed as we speak. So that's where we normally are at a disadvantage, but we're not bottomed out. And I'm sorry, I don't have those numbers for comparison with me as well.
So could you get back to me with the last couple years of data on the total amount of collections and the percentage of what's outstanding that we're able to collect?
Certainly, I will do that.
Thank you.
Councilman Jones.
When you collect the dollars, obviously they go to the parent raising the child. How much does the county, what percentage of that dollars collected does the county actually keep for the county's work or efforts?
Go ahead.
Is that
Under the state law, we're allowed to collect a 2% fee, okay? So if the person's ordered to pay $100, the wage order is for $102, okay? Now, we only take our $2 after the payee gets all her money, okay?
His or her money, yes.
Her money, sorry, their money, the absent, or the custodial parent. So an example, suppose a guy's supposed to pay $100 a week, okay? If he pays $100 a week, 102 comes in, okay? On those months where there's only, because every 3 months there's going to be a fifth pay. So first month there's 4 weeks, and then 5 weeks. That first month she's going to get all that $433, okay? Or actually $408, okay? Because she didn't get all her $433. Everything's calculated on a monthly basis in the SET system, child support system. So it's only until that 3rd month do we actually get our fee. Currently, I would say we probably collect about 1.5% of all the fees that we are supposed to get. So instead of getting the full 2%, we only get like 1.5%.
because you only deduct the fee on the 5th week of the month? Is that what you're saying?
Yes, in that scenario.
So they pay $100, and if the child support order is for $100, they pay $100. I heard you say 102. I didn't get.
Well,
Annually, it should wash out. When you look at the full calendar year, it should wash out. What Rick is describing is, so the same way we get our paychecks. If a person, it depends on the frequency in which they're paid. So if you're talking about somebody who receives a check once a month, and their order is $102 because of the fee, and it's only on current support that you have the 2% fee. But if it's $102 and they get paid once a month, then yes, we're going to collect the full $102 because we get one check. What he's saying is if you have a biweekly payment, or depending on if they're paid bi-monthly, if we only receive within the month of, March, if we only receive $95 for whatever reason, the way it comes in. We do not collect our fee until current support has been paid to the family. Okay, and then if say we receive that $95, and I'm just throwing out generic numbers, but $95, and then in April, say there are three pays within that monthly cycle, then we would have the opportunity, because you're going to surpass that $102 at some point because you're collecting 3 paychecks. So that's when we would collect the fee within that month.
So if the order is $100, you only get your fee if the person pays.
Once the system reads that that monthly support obligation has been met. So we're not going to get, if for some reason the collection falls short, whether it's because somebody no longer works there or what have you, then our fees just keep adding up. But it's within, as every month changes, the first obligation is due for current support to the family.
So the 2% is only paid if the custodial parent has received the full amount that they were entitled to.
Exactly, yes.
Okay. Okay.
But it's still due and owing. Our fees are still due and owing at some point.
All right.
Again, last year we collected $4.5 million in fees.
How much?
$4.5 million.
How much was required? If 4.5 was the amount collected,
If
what
we
was
had
the amount
collected everything,
charged?
it probably would have been 5.5, something down there.
And what do we do with those fees?
Those are out there so that, even after the child is emancipated, the wage order is not stopped. It's only stopped after the person's paid everything. So eventually, those fees are collected as long as the court doesn't order the payments to stop.
She's asking, what do we do with
What do we do with our 2% that we collect?
Oh, okay, that's considered program income. So we have to deduct that from our total cost for our program.
Okay.
Ohio, for instance, for every dollar that's spent, we collect about $5 to $6, closer to $6, I believe. California, they were collecting $2 for every dollar they spent. So Ohio does a really pretty good job of administration.
Okay, so our administrative fees and all that comes out of, is that's what you're saying, it comes out
Yes,
of that 2%?
it comes out of that's first deducted before we get our federal reimbursement.
Okay. All right, any other question? You got it?
If the non-custodial parent pays the $100 but not the 2% fee, and they paid the 100 but never paid the fee, are they considered in arrears for the fees?
Yes,
They are in arrears.
Yes.
and if he gets a lump sum, we'll take the lump sum and get our fees.
Okay, and how can we, following up on that, how can we, since it was mandated that it only, was it mandated in their support orders that they had to pay that $100 plus a 2%? Okay.
Yes.
All right,
Yes, Madam Chair, yes.
okay.
That's part of the court order.
Then the last question, when the fee is 2%, if the court order is $100, why is it not $98 and a $2 fee as opposed to tagging $2 onto what I think I understood you called the court order as being $100?
The current support is determined by the guidelines. So when you run the guidelines, that's strictly for child support. And then it's just written that plus a 2% fee. So when we're determining what the actual child support obligation should be, it's based on all the factors and determinants that are coming in based on the party's information that determine actually what this child support obligation is. And then it's 2% of whatever that determination is that determines the fee. So that's why it differs for parties as well.
I heard that. I'm not sure I totally understood. I guess what I'm envisioning it is at the domestic relations or at the juvenile court, and they give the court order and say it's $100, and the person hears I'm supposed to pay $100. Do they then? Is it later in the process that they're told it's $102, or is 102 said at the at domestic relations?
Yes, and just to let you know, so we do administrative orders too. So there are orders done at the Office of Child Support. So the courts, as well as the Office of Child Support, it is clearly written in the orders, and they are told, yes, So your order is $100 for current support, because there could be other sub-orders too. There could be medical orders that we need to address. So what, I'm trying to think what other type of orders. If there's an arrearage payment for past due balances, you're told there's a $20 payment towards that balance, here's your balance. So they're clearly written so that you understand what the order is.
Councilwoman Brown.
One other question along those lines. When you spoke on the other orders, are there additional fees tacked onto that, or is a 2% fee encompass on all orders, on all the orders?
We don't double charge on arrears, but there's a 2% fee for the total.
Okay, so and just to kind of, and I don't know if it was clear, but the way I understood it is if they're billed $100 and if we were only to do the 98, then we would be short changing the custodial parent of 2% of whatever that charge would be. So the 2% is actually like an administrative fee for our work that the chairwoman kind of spoke on that we collect. So is that a good?
Correct, and we like to think of it as what's due the child in this order. So if it's
Right.
one child or two children, you're correct.
Okay.
In terms of, not Medicaid, I think they're still eligible for Medicaid, cash assistance. So walk me through a little bit. If the custodial parent is on cash assistance and the child support starts, courts, they find the father or whoever the parent is.
You're asking where the money goes?
Well, I know we give the custodial parent some child support, but don't we take whatever we're,
If they're actively receiving cash assistance, that's reimbursable back to Human Services. So that's why we encourage, if a party is, which most people already know, but if you're receiving more from the child support collection as opposed to the benefits you're receiving in cash assistance, which would be our goal, to be able to help you not receive cash assistance, then you will receive your child support. But otherwise, if you are receiving cash assistance, we have to reimburse that back.
okay. So some parents, custodial parents that receive child support, they can still be eligible for SNAP, Medicaid, and child care vouchers.
Yes, and those parties who receive cash assistance, you have to cooperate with child support.
Okay.
So if you don't have a child support order, you do have to come apply, or not apply, but actually you have to come cooperate with us for a child support order. So we can get paternity established and then get an order established.
Any other final questions? Okay, hearing none, thank you both. We would like to move R2019-0074 to the full council for under second reading suspension. I'll make a motion to that. Is there a second?
Second.
Moved and seconded 3 times. All in favor, say aye. Aye. Thank you both.
Thank you.
May I ask one follow-up question?
Yes, please stay.
Did I hear you correctly that in effect you cannot receive cash assistance and child support payments at the same time?
That will be correct.
Yeah, okay.
That's all right.
Thank you.
Thank you again.
Madam Clerk, if you could read the last item into the record, please.
Resolution number 2019-0075, authorizing a revenue-generating agreement with Cuyahoga County Board of Developmental Disabilities in the amount not to exceed $823,375 for reimbursement of staffing services for the DD Medicaid Waiver Program for the period 1/1/2019 to 12/31/2020.
Good afternoon.
Good afternoon.
Bob Math from the Department of Health and Human Services on behalf of Job and Family Services. And with me is Christy Nichols, who's the Deputy Administrator of Medicaid over at JFS. We are recommending a 2-year contract with the Cuyahoga County Board of Developmental Disabilities. This is actually the second time we've had a 2-year contract with them. The Board of DD actually reimburses JFS 100% for all the salaries, which includes of the JFS staff, which includes 1 supervisor, 10 eligibility specialists, and 2 customer service aides, as well as any technology costs that are associated with them providing the services. And these staff are hosted at Board of Developmental Disabilities locations. And the caseworkers there, our caseworkers that are housed over at the Board of DD, are responsible for for determining income eligibility for developmental disabilities consumers, seeking initial enrollment in the waiver program, and then doing ongoing eligibility redetermination for consumers that are already in receipt of the DD waiver. They also do income eligibility for consumers who are either residents or potential residents of the intermediate care facilities. Right now, our staff are housed at 2 locations, one in Parma and one in East Cleveland, and the board is in the process of consolidating both those sites into the William Day Patrick Developmental Center over on Community College Boulevard. And so these staff all determine eligibility. So the reason they're on site, I mean, this is something that the board, requested from us. Our staff are on site at their facilities to really address consumer needs and provide easy access of their consumers to programs. Currently, these units have approximately they serve about 8,000 cases. So it's really a benefit to the consumers as well as to the Board of DD. And again, they cover 100% of the cost. So it's in some respects would be considered a revenue generating contract.
Consumer needs.
So if you have some specific question about the nature of the program, Christy's really our resident expert on the Medicaid program. I'm sure she can address them. I'm sure that's not in my wheelhouse.
Okay, and the 10 eligibility specialists, they're solely for this contract, Board of Developmental Disabilities. They're not involved in.
Council Chair, that's correct.
Okay. Any other questions? Mr. Miller? None? All right. Well, unless there's something else that you want to share, we're very familiar with this contract, and of course, you need second reading suspension.
Yeah, unfortunately, this contract, as you see, is a little late. There were, the ongoing negotiation between the staffing levels, the locations, because they're in the process of moving, and some of the contract language. It just got, I think we started in ample time, but there were just some delays in the process. So, fortunately, it's a reimbursement contract, and they don't reimburse us till after the first quarter. So that first quarter hasn't come, it hasn't ended yet. It would be ended at the end of this month, and they would send us a check, sometime during the month of April. So, if we could have second reading suspension, clearly it'd be beneficial.
Okay, so 100% reimbursed. So do we put money up, or is it an invoice, or?
No, they just send us a check.
Okay.
It's monthly. It's a quarterly installment.
Quarterly, all right. Yes, Councilman Miller.
I'll move favorable recommendation for 2019-0075 on second reading suspension.
Moved and seconded. All in favor, say aye.
Aye.
Thank you both for coming out.
Thank you.
Thank you.
Any miscellaneous business? All right, and I hope that presentation about the call center was very helpful. And meeting adjourned.